Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, we all know that exercise is good for you. It's an important part of maintaining a healthy weight and a healthy heart.
Yes.
But, that's not all. There are other benefits to exercise as well.
I'm sure there are.
Well, let's talk about it.
A study from the University of Birmingham and King's College London found that exercise over the course of a lifetime can also help keep your immune system young and healthy, making it easier to fight disease as we age. Here to discuss the many benefits of exercise is Mayo Clinic anesthesiologist and human performance expert, Dr. Michael Joyner. Welcome back to the program, Dr. Joyner.
Good to see you, Tom. Good to see you, Tracy.
So I guess we don't need to convince you about the benefits of exercise.
Right. Tom, if you look at really every organ system in the body, starting with the brain, the blood vessels to the brain, the heart, the lungs, the immune system, your metabolism, your liver, you name it, your skeletal muscle, your bones. Exercise has beneficial effects on almost every single organ system in the body for people of every age.
Including the immune system. So how does that happen?
Well, what people think happens is that when you exercise, you get a bolus of your own personal stem cells.
Oh. What do you mean by that?
Well, you mobilize these things called progenitor cells. It gets a little complicated, but we all hear about stem cells and regenerative medicine. But it turns out exercise is your own personal dose of regenerative medicine.
Okay.
On a daily basis, those stem cells or progenitor cells goes different places in the body where they help repair, rebuild, and remodel tissues. And that is also true in the bone marrow where the immune system gets started.
So you're suggesting that we have more of these cells that help fight off infection, whether it's bacterial or viral or whatever. Because,
cancer as well.
Yeah, because of exercise stimulating the bone marrow.
Stimulating the bone marrow and stimulating progenitor cells, which some are in the bone marrow, some are other places in the body that go into the bone marrow and then ultimately turn into, quote, better or younger, relatively younger immune cells. So if you look at the immune systems of older people who are physically active, they're functionally much younger than you would predict based on their stated age. And that's also true with their heart, their lungs, their skeletal muscle. And it really is the closest thing to the fountain of youth.
Is there good evidence that people who exercise get sick less often?
Well, it turns out there's large epidemiological studies showing that in about the 30 major forms of cancer, except for melanoma, which is associated with sun exposure, exercise is protective on an epidemiologic basis in about half of them.
Meaning studying a population.
Studying a large population. People that exercise a lot have fewer cancers.
Does it make a difference if, you started exercising as a child and as a high school, college athlete, whatever, you just keep on going? Is it too late to start exercising?
Never too late. Never too late. And the important thing is for people to find something that works for them, something that's sustainable for them, and something that can fit into their daily plan. One of the most important things in the last 5 or 10 years is, people hear about 30 minutes per day of exercise. Well, it turns out you get the same benefit if you do 3 10-minute bouts, and that can be accomplished by something as simple as parking a little farther away in the parking lot and taking a little bit longer walk in from where you are. So a bunch of short, small bouts that give you a cumulative total are just as good as doing it all in one bite.
So we've known for a long time that exercise was good for your cardiovascular system, your heart, your blood vessels. We talked about the benefits of the immune system and these progenitor cells, as you call them. But there's also some recent evidence about the positive effect on not becoming demented as you get older.
Right.
And there was this study in the journal Neurology that showed that highly fit, middle-aged women were less likely to develop dementia decades later.
Well, a couple of things there, Tom. If you talk to Ron Peterson our tremendous Alzheimer's expert here in Rochester at Mayo, Ron will tell you that if you look at the risk factors for Alzheimer's disease, a lot of them have a tremendous overlap with cardiovascular risk factors. They're diabetes, hypertension, blood lipids, inactivity, things like that you mentioned. And so one of the things that happens in the brain as people age is the little tiny blood vessels, the capillaries that take blood and oxygen to the brain and then take waste products away, get stiff, get damaged, don't work as well. And one of the things that is both true in the brain and throughout the body is that people who exercise, their small blood vessels work better and they continue to work well as they age. One of the things we did in my lab with Dr. Joe Barnes, who's now at the University of Wisconsin, is we gave people CO2 to breathe, carbon dioxide. Well, it turns out carbon dioxide dilates your brain blood vessels. And if you look at what happens as people age, the ability of the brain blood vessels to dilate to carbon dioxide goes down. But when you take fit people, give them a carbon dioxide, fit older people, guess what? Their brains vasodilate just like young people.
So it's got a lot to do with blood vessels all over the body.
And blood vessels are everywhere.
I just want to know if it makes a difference if I cardiovascular exercising or weightlifting. I'm probably should be doing both.
Well, and my response to that is yes. So the main thing is do something. And I think for a long time we emphasized mostly cardiovascular exercise, but one of the big problems, especially as people get into their 60s and 70s, is frailty. So strength training becomes important, or keeping your strength up through things like gardening and chores and housework. And I think people still get tremendous benefit from strength training only. I do a combination of both, and as I've gotten older, I'm 59 now, I've started to do more strength training.
What do you think about interval training? We have had heart specialists on here who are touting that as a good thing, as a good form of exercise. First of all, what does it mean, and are you a proponent?
Interval training are periods of faster or higher intensity exercise by interspersed with periods of slower exercise or less intense exercise. It's the absolute bedrock of training for elite endurance athletes. When I was,
it's like us.
Yeah, exactly.
Well, it's how I started running. That's how I was trained to run, and that's how I run.
Yeah, and you see it in the swimmers, you see it in the distance runners, the cross-country skiers, the cyclists, and so forth. And essentially, citizens' versions of this have emerged. So people do a minute or 2 or 3 of fast walking, followed by a minute or 2 or 3 of slower walking, so on and so forth. So there's a couple things. One, it is a very efficient way to get in shape. 2, it can break up the monotony of always doing things at the same pace. You probably get a little bit more bang for your buck. But again, I wouldn't say you have to do interval training. I would say it's a nice thing you can add on to do as well as your normal training. I personally do a lot of interval training, but that probably relates more to my long history in sports when I was a young kid than it does the fact that I'm a middle-aged person.
Statistics show that more than ever Americans are exercising, yet obesity is on the rise. So those things don't seem to go together. What's the disconnect?
We live in a tremendously obesogenic environment.
What does that mean?
It means it's just something that
causes obesity.
Yeah. So, and if you think about it, you're younger than Tom and I, Tracy, but when we were kids and you went to McDonald's, you got a small hamburger, about 15 French fries, and a 10-ounce soft drink. That's about 500 calories. You can
not even on the menu now.
Yeah, you could eat one of those for lunch the rest of your life and you're not going to get fat. It's hard to walk into a fast food place now and not walk out with about 1,000 calories. Things are supersized. It's very, very easy to do nothing all day long. So even though people are exercising, probably what happens is the amount of sedentary time they have overwhelms what exercise they're doing. And then the other thing is that, you go out and walk or jog 2 or 3 miles, that's 200 or 300 calories. Well, you can undo that with a bag of chips.
And don't forget, there's a difference in activity level, too, because remember, you and I were the remote. You might have been, too.
I was the remote.
And we had to open the garage door.
Bingo.
We didn't have a garage door opener. You had to get out of the car. You had to lift the garage door. There's a lot of things that we used to have to do activity-wise that we don't anymore.
Tom. Well, and I'll give you an example is I like to ride my bike to work. And I live about just a mile or 2 from work. But when it's icy and it's cold and snowy from about Thanksgiving to about now, I don't ride. I rode, and I noticed that my weight goes up 2 or 3 pounds in the winter. As soon as I start riding my bike again, just a couple miles a day of biking just goes right down.
By July, you ought to be able to ride your bike here in Minnesota.
Well, one of the real interesting things about that is the big UK Biobank, their version of personalized medicine or precision medicine initiative in the United Kingdom. They've looked at the genes associated with obesity and some lifestyle factors, and people who ride their bikes to work are 1.5 BMI units lighter than people who don't, and that's about 5 or 8 times the effect size of the largest gene variant associated with obesity. So it really matters what you do.
All right, bottom line is you got to exercise. The benefits are too strong to ignore.
And find something you can do, find something sustainable, do it almost every day.
All right, anesthesiologist and human performance expert, Dr. Michael Joyner. Always great to have you on the program. Thanks
Always
for showing
great to
up.
be here. Thank you.